back. This is Boomer Life on CL 650.
I'm tired of waking up tired. Waking up tired. Yeah, waking up tired. I'm tired of waking up
That should be the theme song.
I like that
I'm
song.
tired of waking up tired. Well done. I like that. Yes, we're speaking with the SnoreDentist, Dr. Charnel Muir. You have your clinic in North Vancouver, but you visit other clinics around Greater Vancouver,
yes.
The island, even in the interior?
Not in the interior anymore. No,
okay.
Just on the island, in the valley, and then in North Vancouver.
Okay.
Yeah.
Maybe I misheard you earlier. Let's walk through the process. We talked a little bit about coming into your clinic and talking about where they are on the scale of their just snoring. Maybe they have sleep apnea. So what are the next steps? So you send them home with a device that monitors them. You send that off to a physician that the diagnosis
interprets that, yes.
So how are they listening to something, or is it what are the monitors taking in?
So the monitor that we use in my office have 3 parts.
Mm-hmm.
It'll measure airflow. So it has a little nasal cannula. It kind of looks like that thing that you put on if you're going to get oxygen,
Sure.
except it's not delivering air. It's just measuring whether there's any airflow coming in and out. It has a finger probe, and that'll measure your heart rate and your blood oxygen. And then it has an effort belt, and the effort belt goes around your rib cage, and that counts how many times you breathe in and out. So the basics is what we're looking for is, are you trying to breathe and the air's not coming in? So then we know it's obstructed.
So your chest is expanding, but you're not getting anything in.
That's right. So there's no airflow in at the same time that you're actually expanding your rib cage and trying to breathe. So we know it's obstructed. It will pick up the airflow or flutter of the snores. It will tell me what position you're in when you sleep and snore or obstruct. And it'll tell us all of this data, and it'll tell me whether or not that type of breathing that you have at night is causing a problem with your oxygen. Is your oxygen going down? Is your heart rate racing? Are you having that fight and flight? So we look at all of these metrics, and then it's scored, it's interpreted, and a diagnosis is given. Now, if it's primary snoring or just snoring without sleep apnea, the most common treatment for that patient will be what I do, which is an oral appliance. And we have a lot of selection when it comes to snoring for oral appliances because we can make them less costly and, though unfortunately, then less durable. But when you're only a snorer, it won't be covered by your extended health benefits. Snoring is considered a cosmetic. It's not a medical condition at this point.
But maybe in the future it will
might
be, yeah.
Yes. If there's some sleep apnea, then based on the criteria of what you showed us in your data, what your diagnosis is, what your preference is for treatment, and what your preference is for your physician, then it's either an oral appliance or a CPAP. So if you're going to stay in my practice and get an oral appliance, the next stage is we do paperwork for you if you have an extended health benefit plan. And a lot of the very good plans do cover a lot of what we do. Once we've got all of that paperwork in place, then we see you back for what's called an examination and records appointment. And that's where we do some measurements. We measure your range of motion of your jaw and your teeth. We figure out what teeth you have, whether you have fillings and crowns or just teeth, and whether you wear some dentures or partial dentures. We go through all of that. We design what appliance would be best for you, and then we take impressions of your teeth. Mm-hmm. And that's what's sent away to the laboratory to make your very own custom appliance.
Now, correct me if I'm wrong, but I remember in the last show that we did together, you're trying to get them to bite in the position you want them to be sleeping in.
That's right.
So how do you coach someone through that?
That's right. Well, I use a device called a George gauge, named after someone, yes, with the last name of George, because they wanted to be famous. So we have a George gauge. It's the probably most common device used in those of us that do dental sleep medicine. Some clinicians will use a phonetic bite, it's called, where they'll make you say certain words and figure out where that jaw should be. But I find the George gauge really easy for people. So it's got a little groove for your top front tooth, a little groove for your bottom front tooth, and then you just slide your lower jaw forward and back.
I'm doing it now, yeah.
We get that range of motion. We set the limits of that, and then we set that to be stable at about 50%.
Sure.
And we try that bite in. all patients are comfortable at the bite that we start them at. If they feel that that's really too far forward and feels really exaggerated for them, we can back it up because these appliances can walk forward.
They have adjustment.
Over time. They have adjustment over time. So we don't...
Because I think a lot of people they're thinking of the mouth guard you wear when you play hockey or football or
That's
something
right.
like that.
Yeah.
This hard plastic, nasty, but that's not the case at all.
No, and we do have those actually for sleep apnea. We have over-the-counter boil and bite appliances, and they're rough to wear.
Yeah,
They're
I can
bulky.
imagine.
They don't stay in place. They can hurt your jaws and teeth. So that we don't find a great adherence for patients with those, but the custom-made appliances are made in a comfortable position for your jaw. Remember, the lower jaw it's almost like landing a plane. It can tip and twist and torque and all sorts of things when you close it together. So when you have your jaw forward and your back teeth are slightly apart, there may be more space on one side than the other naturally for you.
Because some people chew on one side and their
That's
teeth
right.
are more worn on one side.
It could be, yeah. Or it could be that the anatomy of the jaw joint up in front of their ear has a different shape in the bone on one side than the other. We've all done that experiment when we were kids. You hold the mirror up and you look at one side doubled and it doesn't look anything like you. And you look at the other side doubled, it doesn't look like you either. And those bones and that facial structure is different right to left. So it's important that the bite be taken on your jaw, in your jaw position, to enable the appliance to be custom made to accommodate anything your jaw does when it moves forward or closes.
All right, I just want to get a visual image of this. So this is something that goes over your top and bottom teeth.
Yes.
And I guess the imprint is, it fits perfectly on your existing teeth, and that's what stops it from moving around.
That's right.
So like a double-sided retainer is kind of the best
Could
way.
be. If someone has experience with, say, Invisalign, you know those clear suck-down type retainers or braces, some of them are really that thin. But there always will be two parts, a top and a bottom part, because we use the upper jaw for stability. It's attached to your head. It doesn't move.
Sure.
And then we use some kind of process to hold the lower jaw slightly forward, like CPR, where you move that lower jaw forward to open that airway and let the patient breathe. And then some kind of hinge or jigsaw puzzle piece that holds that lower jaw in that forward position so that your jaw can rest.
So just a 5 millimeters of movement of your jaw is enough to stop you from snoring opening the airway.
Can be enough for, 1 out of 5 patients never need to move it from that starting position. That's all they needed.
So the secret sauce is picking the right device for their jaw and for their need. And then how much follow-up do you typically need after that?
Yeah, the third part of the secret sauce really is following up with them and knowing how they're doing and what to do with that. Mm-hmm. So we actually see our patients back on a regular basis, and we then will often repeat or send them home with that same home sleep monitor while they're wearing their appliance.
Yeah.
So, because subjectively, they may be fine. Their snoring's fine. They're feeling better. But objectively, we want to see what the heart rate, the oxygen, and the breathing is doing as well.
Because there still could be an improvement on that.
There could still be, And we always try to maximize the effect based on both subjective, how are you feeling, how you doing today, are you sleeping better, and objective, what do the numbers look like?
All right, give me out of 100 people who have snoring and sort of low to moderate sleep apnea. Can these oral devices help out of 100, 80%, 90%, 100%?
We found in a study that I recently was part of publishing that we improved 93% of all patients, even those when we categorize them all together, including the severes.
So even severes, 93%?
Even severes.
Wow.
Yeah. So it can help. And, what we look for is any number of things, because sometimes quality of life improvement matters more than chasing numbers. And sometimes chasing numbers, we get as far as we can. But our goal is to improve them. Our goal is to lessen their health risk of whatever it is they have and make it less so.
But the quality of life part of it with the spouse and the feeling better is a huge part of it. So give us an anecdote of somebody who's come in and their spouse grumpy at them before and how they feel after.
Well, we were just talking at the break. I actually had a spouse come in the other day and said to me, I would marry him all over again now. I certainly wouldn't have before.
Well, that goes back to the study where you said 45% of baby boomers find it unattractive.
Unattractive, yeah. And I will often get the best Christmas cards from the spouse and the bed partner. Thank you. Now we can go to our kid's house for Christmas because I know we're going to sleep in the same room. And I know we're still going to enjoy Christmas.
Well, there's the post-turkey nap on the sofa. Quick, get me my oral device.
That's right.
I'm going down.
I'm going down now. Yeah.
Because that. Now, speaking of naps, that is the best nap of the year. Maybe the post-turkey
turkey
nap.
Christmas or Thanksgiving nap.
Yeah.
Well,
I think it's fascinating. I mean, I didn't know that this was possible. You hear about CPAP machines really is the answer for snoring and for sleep apnea, but a device that you wear, probably the follow-through rate is higher than the CPAP machine.
Yeah, we've shown in study after study that the what we call tolerance or compliance rate with an oral appliance has been higher statistically than with a CPAP, and that's over time we've been able to show that quite effectively.
You've been listening to the voice of Dr. Charnel Muir. The Snore Doctor is what it says on your license plate, but you're the SnoreDentist. And the SnoreDentist is located in North Vancouver. Where are you again? 700
Marine Drive at the corner of Marine Drive and Bewick.
And I'm sure you're going to get lots of spouses pushing their husband or wife into going to
well,
get
it's better than pushing them out of bed. So
here's your option.
Yes.
Pick one or the other. All right. Thank you very much for your time. It's been great chatting with you, and we'll have you back again soon.
Thanks, Zach.
You're listening to Boomer Life on CIAL 650.